My name is Roslyn Mungai, the County Executive Committee member for Health. As Dr. Oyer and Madam Veronica have said, we want to truly align ourselves with the feelings of the family in this moment of grief. It's a very unfortunate occurrence, and as you have heard, the chronology of events from our Margaret Kenyatta mother-baby unit all the way to ICU, the medical team did the best that they could for this mother. We continue to uphold utmost professionalism across board in this hospital. And we want to encourage all our clients, all our stakeholders to communicate with us any discontent that they may have and not to cast any aspersions, especially against the team that is taking care of the clients in this hospital. We have opened up our doors. Like Veronica has said, there are various mechanisms for dispute resolution and communication of dispute. Apart from seeing the administrative team or the medical team in person, we do have complaints boxes. We have a social media page where the hospital is able to respond. With regard to this family, in fact, just this afternoon, they have been engaging with the hospital administration about the way forward, about the post-mortem that is planned, and about any other questions that they may have following the unfortunate demise of Elizabeth. Thank you. Okay, so the capacity of this hospital, I think as he has spoken about, in terms of the mother and child facility here, Margaret Kenyatta, is severely overwhelmed. If you speak about 640 or so deliveries a month, with the number of nurses that we have, it is severely suboptimal. But Her Excellency the Governor has committed herself to filling up all the resourcing, the human resource gaps that are evident in our facility. What we do is that we encourage the medical team to believe in the reforms that have been put in place, to believe that progressively we will continue to promote our staff, we will continue to recruit new staff, we will continue to replace staff as they leave. So that is in terms of human capacity. But even in terms of capability, we are investing a lot of resources in developing technical capability of our staff. But in terms of equipment, which is something perhaps Dr. Oyer didn't quite dwell on, there's a very robust infrastructure or development committee within this hospital that looks at the capability of the hospital in terms of equipment across board for all the units. But as you are aware, you cannot fill all the gaps at a go. Everything goes with the planning process, and budgeting process, and the demands are many across board. So you may feel that perhaps we need to expand the ICU capability, maybe we need to buy a few more ventilators or whatever it is. It's the same we will have to do in the renal unit, it's the same we'll have to do in the cancer unit, but we have a grand plan to ensure that this hospital is able to take care of the clients that are within Nakuru, but also the ones that are referred from beyond Nakuru. Our government, inspired by the national agenda for developing the capability of primary healthcare facilities, has really ramped up the capability of maternity units across the sub-counties. We actually have 93 maternity units across the sub-counties. If you look at Nakuru town, east and west alone, we have a facility at Lanet, we have a facility at Bondeni, we have a facility at Ronda, at Langalanga, at Mirugi Karaoke. But mothers still prefer to come here because of the prestige and reputation that Margaret Kenyatta has. What we are encouraging our mothers to do is seek care where the facility is available near you and only come here for the more complicated cases. That will also ease the workload of our staff here. So if you have a normal delivery and the baby is delivered at Lanet, should it be that there is a complication that arises, it's not very far to be referred here. The same case if you are in Molo. Rather than there is Elbagon, there is Molo Sub-County Hospital, there is Njoro Sub-County Hospital. So I want to encourage the public to believe in the healthcare system within the primary healthcare system. Thank you.
Kwa majina naitwa Dr. James Waweru, msimamizi wa hii hospitali ya Nakuru ya Rufaa. Tunasikitika sana kwa hii kesi ya Elizabeth Wairimu mwenye alipass on 2 days ago. Hii case kwa kama vile tulikuwa imeandikwa hapo mbeleni. Hii mama alianzishwa operation saa 4, ikaisha saa 5:30. Kitu saa 6:30 ndio alipatikana na hizo complications za kupumua. Alafu madaktari wakafanya chenye wangeweza wakiwa huko theater, na akawekwa kwa ventilator katika theater. Wakati huo ndio sasa walitayarisha ventilator ya ICU na akahamishwa akapelekwa ICU. Akiwa ICU, kwa bahati mbaya akaaga kitu saa 12 jioni, na familia wakakuwa notified. So wakati alikuwa, kuna mahali watu wanasema kulikuwa na delay ya kumpeleka ICU, lakini wakati huo wote alikuwa kwa ventilator hapa kwa theater. Ndio wakati kitanda ya ICU ilipatikana na ikakuwa tayari, ndio akahamishwa. So hakukuwa na gap in terms of that care ya ICU, because akiwa hapa theater alikuwa kwa machine ya ventilator all that time. So ningetaka kuhakikishia umma na watu wenye wanatumia hii hospitali kwamba ventilator yenye iko theater na ventilator iko ICU ni sawa. Na kitanda ya ICU saa zingine unapata haipatikani kila wakati. So wakati unatayarisha hii kitanda ya ICU, ama wakati unatayarisha kuhamisha mgonjwa kumpeleka ICU ingine, mara nyingi tunaweka wagonjwa kwa hiyo ventilator ya theater. Hata mgonjwa anaweza wekwa hapo kwa masaa 24 ama 36 hours. And it is safe na ni standard ventilator. Yes. Kusema ukweli, Elizabeth wakati alifanyiwa CS alitumia ile ya kugandisha nusu. Kwa hivyo hakuwa amewekwa kwa ventilator saa hiyo. Na hii shida ya kupumua mpaka saa hii hatujaelewa kwa nini alipata shida ya kupumua. And that is ndio hiyo sababu tunapanga na familia vile tutafanya postmortem tuweze kuelewa kiini hasa ya hii shida ya kupumua. Yes. Mortality ya wamama sasa, kuna wengine wanakuwa referred na wengine wanatoka hapa. Wamama wenye wanatoka hapa wenye wanapata complication hiyo inafanya wa pass ni kitu kama 2 per month. Then kuna wenye wanakuwa referred, hao wanakuwa kitu wengine 2 per month. In terms of ICU capacity, hii hospitali iko na vitanda 6 ya ICU na tunakubali haitoshi, lakini it's work in progress. Mambo ya staff kwa health sector all over the country, hata in the private sector bado haitoshi. So but the county government of Nakuru is working on it. I think we are aware there was an advert and they are recruiting 353 nurses wenye wanakuwa recruited saa hii. So we are hoping hii itakuja ku ease the burden ya workload. Kwa hii hospitali mimi ningerecommend kitu kama 20 beds ya ICU plus HD. Yes.
Kwa majina naitwa Veronica Ongoe, mimi ni muuguzi hapa Mother and Baby, and kulingana na kazi yenye tunafanya, wauguzi wamejitolea sana, wanaenda an extra mile kusaidia wamama. That is why always unapata wamama wamejaa Mother and Baby. Like now you will not have any bed that is missing a patient. And even when we talk to them, tunauliza kwa nini mnajaa Mother and Baby, they said because of the services they are receiving. So kwa niaba ya waguzi, they are working hard to be able to deliver the services to our mothers, and they are really motivated to do the work. So for now, midwives, we need to appreciate them. They need also to be motivated. It's not easy. Delivering 40 mothers in 24 hours, it's not something that is easy. So it is a hard work of the midwife, and we aim to have all good outcomes. However, sometimes tunapata a bad outcome that can happen
which is not, it is beyond us. Sometimes it is beyond us, and we are human also. When they cry, we also cry with our clients. So that is when it comes to nursing as a profession. And we are trying as much as possible to practice professionalism when offering services to the community of Nakuru County. Yeah. As a unit, we have a channel of communication. When one is not satisfied, we have numbers displayed in the wing so that they are able to raise their complaints. And again, we have various leaders in the wing. We have the administrator, we have the HOD, who is a gynecologist, and other team members that work hand in hand. And even one-on-one, we are able to get feedback from the clients when they have issues. Yeah. We are here for them. Kindly share your complaints with us because we are ready to serve you guys. And the reason why we are here, it's because of you. Without you, we cannot be here. So kindly talk to us. We are ever ready. Yeah.